In this episode of the Nurse Practitioner Videocast, we chat with Dr. Laurel Short, President of the Kansas Advanced Practice Nurses Association. Thanks for taking the time to chat with us today, Laurel.
Thank you so much for having me. I'm really excited to be here.
Can you please provide us with an overview of the Kansas Advanced Practice Nurses Association, or KAPN, as a whole?
Absolutely. So KAPN stands for Kansas Advanced Practice Nurse Association, and it has an interesting history to it. It was developed under a different name called the Kansas APRN Task Force over 15 years ago. And it was very grassroots, the initial small group that came together, which I was not part of because I wasn't quite an NP at that point. I've been a nurse since 2006 and a nurse practitioner since 2010. And the original small group that came together, it really came out of some experienced APRNs who wanted to work on advocacy and legislative efforts for the state of Kansas. At that time, there were a number of other states within the United States that had achieved full practice authority for APRNs. And some APRNs in Kansas got together and said, this would really benefit our state to reach a lot of the rural, underserved populations, both in rural and urban areas. And so that was the initial efforts of the organization were really focused on advocacy and legislation. Over the years, which we can kind of get into a little bit more if you're interested on what's happened with the legislation. But just to kind of briefly overview what's happened with KAPN is they, were slowly growing, becoming a larger organization. And then within the last, 3 to 5 years, we've really kind of branched out more across the state and said, we have some of these other smaller organizations, kind of working separately alongside KAPN, but not necessarily all together. And so we officially merged all of those associations under the umbrella of KAPN within the last 3 to 5 years. And personally, I was part of another association that started in around 2012, and we were the Northeast Kansas Association for APRNs. And so we were kind of doing some things in Northeast Kansas, and I was involved with that group. And then again, within a few years said, let's not be doing things in parallel. Let's all come together so we can bring all the leadership together and be a stronger association and meet the needs for APRNs across the state.
For NPs who might not be familiar with KAPN, can you please tell us about KAPN's member benefits?
Well, now we are in a new phase of our organization to say, all the focus since this organization was developed, really the priority has been on legislature and advocacy. And that's still very important. And so some of our member benefits include still supporting our current lobbyist, the 1861 group, because we still need to know what's going on in the Capitol, and we need to know about legislation and laws that may be pertinent to APRNs, advanced practice nurses. But now we can kind of take a step back and say, what else do we want as an organization, and what are the goals that we're working towards, and how we continue to grow our organization? So we have now had 2 annual conferences, and being a member allows you to have a discount to that conference and have access to all the things that the conference offers. We have also started implementing quarterly member meetings. So one of those is live every year at the conference, and then those other meetings on a quarterly basis are virtual. And that's to allow continuing education, staying up to date on what's going on around the state, and answering questions about this new phase of having full practice authority for the state. We're also working on additional member benefits that we can continue to grow. And one of those we're very excited about is with the Nurse Practitioner Journal. So now all members of KAPN will receive the journal every month at no additional cost. That's part of your membership. And that also brings opportunities to apply for publication and participation in other things that the journal offers.
Can you tell us a bit more about the current legal, regulatory, and/or practice issues you're dealing with?
So KAPN, we're really in an exciting phase right now. as most of our listeners probably know and hopefully know, we did successfully achieve full practice authority in the spring of 2022. And that was a long journey. It might seem like, oh gosh, all this just happened within the last year or two, but it was really over 10 years of work to make this happen. And it just takes a long time for legislation to become successful, especially when you have an association that is completely volunteer in nature. So over the last number of years, we were getting more support within both sides of the aisle. This is a bipartisan issue working towards full practice authority, but we're still meeting some roadblocks with some opposition of some other associations, and even within the legislature, there were a few key leaders who were not supportive of us. And so we kept, unfortunately, getting blocked going through the House side and the Health Committee. The chair of the Health Committee was not supportive of our bill and of full practice authority for APRNs in Kansas. So fast forward in 2020 and 2021, we were still struggling because of these roadblocks and because the priorities of the legislature were elsewhere during COVID-19 and the heart of the pandemic, which is to be understood. So as we were nearing the legislative session for 2022, we actually considered not running the bill for that session because we weren't sure if we could afford it. And we just, again, had been meeting these roadblocks and thought, well, maybe we need kind of a rebuilding year if you use a sports analogy. Well, fortunately, we did have some champions within both the House and the Senate in the state of Kansas, and they heard that we were considering not running the bill and said, wait a minute, we really think you need to maybe just re-strategize, and instead of keep, moving forward in the same kind of path and going through the House, maybe we should reconsider going through the Senate side and looking for maybe some champions and some stakeholders in places that you haven't. So all the stars kind of aligned with getting a champion on the Senate side and getting support from associations that were outside of maybe what you would normally think for supporting APRNs and businesses, and the Chamber of Commerce and Americans for Prosperity. And AARP was a huge supporter. So these associations that really saw all the need and benefits of providing high quality, affordable health care from APRNs. So it took a lot of work, and we got a lot of support nationally from the American Association of Nurse Practitioners and the National Council for Nurses. So all of this came together, and we got a lot of help from just citizens across the state writing to their legislators saying this is why we need to be able to access healthcare through APRNs and all types of clinicians, really. And so we successfully passed full practice authority in April of 2022, and that now has gone into effect with all the permanent rules and regulations as of September of 2022.
Are there any obstacles or challenges you've seen or overcome in family practice or from a legal perspective?
There's always going to be challenges when it comes to both family practice and specialty areas. Personally, some of the challenges that I see in family practice are just wishing that there were more hours in the day and hours in the week to meet patient needs. I think those of us who go into healthcare do so because we're very passionate. It's not a job, it's a vocation. And we want to meet our patients' needs. We don't want patients to have to wait for things, whether that's getting in for an appointment or answering a portal message or getting a referral sent. But sometimes we are limited in how much we can do in a day. So I think that is a big challenge, just being able to meet the needs of patients and keep up with all the things that we need to do each day. We're kind of continually stacking paperwork that needs to be done and different computer tasks in addition to doing our patient care. And I think most of us went into this because we really like being with the patients, and the other ancillary things are we just kind of have to fit in and get done. So documentation and all of the other administrative things that come with being in a specialty like family practice, to me, is the largest challenge. And I think if we're kind of talking about the advocacy and maybe political barriers, even though we have passed full practice authority, This is a transition time. It's not a light switch that, a state achieves full practice authority and then, wow, we can just, have everything be seamless. There is a transition time when it comes to pharmacies, understanding that we no longer need a collaborative practice agreement and a co-signature on things. And then if you are an APR and working for a healthcare system, it is still up to a healthcare system if they want to require a collaborative practice agreement. And so there's some things to navigate with that, and understanding there's a difference between what the state of Kansas is requiring legally and what a healthcare association is requiring. And then even with achieving full practice authority, there are still some things that have not been changed from both a federal and state standpoint that we're going to be working on in the future. The best example of that would be certain types of documents that are still requiring a physician or MD signature, such as diabetic shoes or some types of home healthcare documentation and death certificates. And so this year in 2023, we are not introducing active legislation, both because we need some time to kind of regroup as an association, and also because we have been told by leadership in the Capitol and the legislature that, we just passed this bill last year. And so it just really wouldn't look best if we went back and said, well, now we want to do, X, Y, Z. Because then they may wonder, well, why didn't you put that in the other bill? Or, you just got this passed, so why are you coming back this year? So basically just giving a pause and kind of letting us implement what passed last year, which was extremely positive. And then within the next, 2 to 3 years, going back and seeking what would be called a universal signature bill, which then once passed would allow us to basically anytime a document that now currently requires a physician signature could also be signed by an advanced practice nurse. And that's why it's called a universal signature bill. Again, still needs to be within our scope of practice as an advanced practice nurse, but it would be a lot more seamless than seeking all of those documents separately.
Would you like to share any final thoughts?
So final thoughts that I would share is, if you're not already a member of KAPN, we would love to have you join. It's the best way to stay up to date on what's going on with your state, whether that's advocacy, policy, kind of boots on the ground. What are your colleagues seeing, staying up to date with continuing education from experts in the state. We're really excited that the last 2 years at our conference, all of the speakers have been local, whether that's Kansas or kind of the metro area between Kansas City, Kansas, and Kansas City, Missouri. And we just have a wealth of wisdom and expertise within our own region. And so it's been wonderful to bring that to our state conference. And we're continuing to grow those member benefits. And now that we are in a new phase of our association, we just updated our bylaws and restructured having additional committees. So not only are we seeking members, but we're seeking leaders who would like to participate with committees. And you can go to the KAPN website and easily find contact information for all the board members. And just reach out and say, hey, I want to get involved, and we'll find a spot for you. So appreciate the interest. And we look forward to this new phase of our association where we're growing and becoming stronger and continuing to really just be the professional association for APRNs in our state.
Thanks so much for your time today, Laurel.
Awesome. Well, thank you so much. I really enjoyed it. And yeah, in the future, we can do updates and happy to be a resource for you guys too.
You can find out more about KAPN at kapn.enpnetwork.com. That's kapn.enpnetwork.com. Also, be sure to follow the Nurse Practitioner on Facebook, Instagram, and LinkedIn at the Nurse Practitioner Journal, and on Twitter at TNPJ_journal for all of the latest updates. Thanks for watching.